Good afternoon, class, and welcome to your final semester of your BSN program, and welcome to Advanced Health Deviations and Clinical Interventions. Hopefully you've had the opportunity to complete your reading assignment on hospital-acquired infections and hand hygiene. Let's get started with our PowerPoint presentation. The goal of this mini session is to provide you, the undergraduate nursing student, with knowledge regarding infection prevention. At the end of this course, you will be able to identify methods for preventing CLABSI and CAUTI in the inpatient setting. You will be able to identify components of the CLABSI and CAUTI bundle. You will be able to verbalize the proper technique for hand washing, and you will be able to verbalize the 5 moments for hand hygiene. Let's get started with central line associated bloodstream infection, also known as CLABSI. CLABSIs are the result of an intravascular device being inserted in your patient, which creates a pathway for bacteria and fungus to enter into the bloodstream. It is the most frequent complication of a central venous catheter, and also the average cost ranged from about $33,000 to $75,000 per case. So it's a very expensive infection. The risk factors for CLABSI include critically ill patients and cancer patients, which is primarily due to the type of medications that they receive and also the fact that they need hemodynamic monitoring. The femoral site puts the patient at higher risk for CLABSI, as well as non-ICU patients who are immunocompromised. The clinical manifestations of CLABSI fall into 2 categories. You have your local, which is redness, edema, tenderness, or discharge, or it could be systemic, as evident by fevers and chills in combination with hypotension, hyperventilation, and an altered mental status. So here we have a mnemonic to help us to remember how to prevent CLABSI. The Kuros, which is a proper name for a protector that's used on all of the ports. We want to make sure that you're using your Kuros caps, that you limit the use of the femoral line, you assess the line daily, and you give the bath, you do the site inspection, and utilize the insertion checklist. And we'll go over the insertion checklist a little bit later. So here we have the CLABSI bundle, and I want you to be very familiar with the term bundle. When you get into practice, you may not hear the word prevention used as much as you will hear someone say, are you using the CLABSI bundle? And so it's typically the same things that you would do to prevent CLABSI. Again, the terminology is what I want you to be familiar with. And so it incorporates all of the things that you would do to prevent CLABSI. We talked about the site inspection, and here you will actually see a central line dressing along with the bio patch. And so this bio patch is the blue circular patch here that's at the insertion site. It is an antimicrobial patch that will also decrease any risk of bacteria entering into the bloodstream. This is a copy of a checklist from the CDC that you can use to remind you of all the things that you could incorporate in order to prevent CLABSI. Your organization may not use this exact checklist, but be familiar with various checklists that are used to help remind you of all the initiatives. So now we're going to move forward to the CAUTI. Likewise, the CAUTI is a result of an indwelling urinary catheter, which increase the risk of your patient getting a urinary tract infection. Urinary tract infections lead to nosocomial infections, and those increase your risk of morbidity, mortality, and high cost, hospital costs. It is also identified as the 3rd most common infection in the ICU setting. So I know several of you are interested in going into critical care, so just be aware that this is a common infection in a critical care environment. The risk factor for developing a CAUTI is females. Females have a higher rate. In one study, it was 59% of developing a CAUTI, and that's primarily due to the fact that there are not many alternative methods or products for a indwelling catheter. So with the male, we can use a condom cath, but we just don't have that many products for females. Also, the length of stay, antibiotic use, and the duration of the catheter will increase the patient's risk. And it's manifested by fever greater than 38 degrees Celsius, suprapubic tenderness, urinary frequency, urgency, and dysuria. Just keep in mind that if your patient is on a vent, or if they're sedated and unable to communicate, they may not be able to articulate any urgency that they have, but you will be able to see the increased urine output and the temperature. Likewise, we have a mnemonic for CAUTI, which includes the cleaning, alternative methods, use of a silver-coated catheter, having trained personnel, and making sure, again, we assess the need daily. A lot of times we find that the nursing staff may not be quick to remove a catheter because they'll have to constantly, put the patient on a bedpan, and so it's just easier to leave the catheter in. But I strongly discourage you from developing that practice because, as you can see, it increases your patient risk of developing a CAUTI. So just be mindful of that. Likewise, we have a CAUTI bundle, and again, be very familiar with the term bundle. It includes all of the same techniques that you would use to prevent a CAUTI and maybe even more. So again, we're going to assess the need daily. We're going to use some standard precautions, which include hand hygiene. You want to keep that catheter and the drainage tubing free from kinks, which can increase the risk. So with that being said, do you want a water slide or do you want a roller coaster? Absolutely, you want to go for the water slide. A roller coaster will create a situation where the urine will be stagnant and increase the patient's risk for infection. And so based on that and based on your readings, what can you identify in these three pictures as being a problem or putting your patient at an increased risk for developing a CAUTI? Absolutely. In the upper right hand corner, you see your tubing is actually touching the floor. And then your pictures on the left, upper left and lower left, you see the urine is stagnant in the tubing, and it's also increasing that patient's risk for developing a CAUTI. So again, we don't want the roller coaster. We want a slide that's going to drain properly into your bag. And so we have some other items within the CAUTI bundle, and again, you should have covered all of those in your reading. So, what's the #1 way to prevent infection? You're correct, hand hygiene. We want to make sure that we're doing proper hand hygiene. So what's proper hand hygiene? Here we have a poster on how to wash your hands. When you go into the SIM lab, you will notice that they're posted up above every sink. And also we have some handouts to give you at the end of class. Likewise, your 5 moments for hand hygiene are just as important. So when you should be washing your hands: before and after you touch a patient, before and after you touch any equipment, anytime you come into contact with body fluid or anything that will put your patient at risk for developing an infection. So, a lot of people say, oh, washing my hands, I'm okay, they're not soiled, they look clean. It doesn't matter if they're physically soiled or if they're visually soiled, because there's still bacteria that's on your hand that you can be transmitting from place to place. So let's take a quick look at this video so you can truly understand the importance of hand washing.
I got you.
So what did you think? Absolutely. Washing your hands just makes sense. So do we have any questions? I apologize for that. So are there any questions before we end class today? All right, so don't forget to pick up your handouts on the 5 moments for hand washing and how to properly wash your hands. And right before we leave, there's one other visual that I want to show you. And this is actually a dressing change kit for the central line. And I just want to open this kit. And it's a sterile kit. And it also has your mask in here. And a bonnet, because when you're doing a central line dressing change, again, it's important that we have all of our PPE on. So I wanted to show that to you. And I'm going to pull just a little table over here to assist me. And when you open your kit, again, this would be a sterile technique, you will find that you have all of the items in your kit that you need. Alright, so again, I'm going to have the kit up here so you can visualize it, you can touch it and feel it. And I hope that you enjoyed the presentation on hospital-acquired infections and how to prevent them. Have a great day, and I'll see you in class on Wednesday.